Okay, is this? No, that's not on. Not on. Is it on? Can you hear me? Excellent. Hi, everyone. Welcome to the diploma ceremony here at the college. It's great to see so many of you here, so many happy, smiling faces. I would like to apologise that we couldn't do anything to control the weather today. It has been at times lovely and at other times a bit wet. So thank you for braving that weather to be here. We're going to get started in a few minutes. You're not going to have to listen to me for too much longer, I promise. I'm just going to explain kind of how things are going to run today before the official proceedings start. So to begin with, we will have a procession of our kind of delegates coming in. Our president will start that. I would ask you to be upstanding at that point for them coming in. They will then process in and take their seats, and you'll be seated at that point. The president will welcome you all, and we'll start the official proceedings. We'll then move on to doing the honorary fellow citations. We have 2 honorary fellows today. So there will be one citation speaker and an honorary fellowship presented, and that will be followed by a second one. After that, the president will pass on to our honorary secretary, who will ask you to recite the oath, or she will recite the oath and ask you to say "I do" at the end of it. So all of our diplomates, and that is you kind of officially joining the college. After that has happened, it's then your turn to come up and walk across and be congratulated for all the hard work that you have done. So basically the way that we will do this is we will start from this side, and you will come up first. You will kind of queue down this wall. You will then walk across when your name is read out. You will shake the president's hand here, and then you will shake the vice president or the dean of your faculty and receive your certificate of attendance. And then you will make your way back down this way to your seat. And then we'll move to this side, and you'll do the same thing and coming back along the middle to your seats as well. I would like to point out this lovely gentleman over here, who's a photographer, and he will be taking a picture of everyone receiving their scrolls. So when you're doing the handshake and receiving your certificates, if you would like to look up and smile at this gentleman over here, you will get a lovely memento of that special moment for you. After that, the president will then do his speech to you, welcoming you to the college and various bits and pieces. And then once that's complete, that is the official end of our proceedings. We would again have the procession going back out, and you will then follow that on, and we will have the exit at that point downstairs to the drink reception, where you can again celebrate with your friends, your family, and some more of our kind of council members and have a chat with them. I should just a couple of housekeeping things. We're not expecting any fire alarms. If we do hear a fire alarm, the fire exit is over here where the lovely photographer gentleman is. So you would make your way out that side. And whilst we do encourage you all to take your own pictures with mobile phones and things, can I please ask you to make sure that they are on silent mode? Just again to point out, in case anyone needs to use it as part of the ceremony, we do have a family room downstairs that does have this streamed down to it, so if anyone would be more comfortable going down there and watching it, you are more than welcome to do so, even throughout the ceremony itself. So you're very welcome to know that that is me finished talking. I'm not going to be boring you for too much longer. We'll just get the procession started, and you'd only got a few more minutes to wait until your ceremony starts. But thank you and congratulations.
My name is Mike McKirdy. I have the great honour and privilege of being the President of the Royal College of Physicians and Surgeons of Glasgow, and welcome to all of you this evening, our new diplomats and about to be new fellows and members of the college, and also your friends and family at the back of the hall who've come to support you this evening. A very warm welcome to all of you. Our college, soon to be your college, was founded in the year 1599. Later this year we will celebrate our 425th birthday. And we were founded by the gentleman whose portrait is on this wall, Maester Peter Lowe. He was born in Glasgow around the year 1550. We're not certain of exactly when, but we know he was born here in this city. At that time, a pretty quiet, sleepy academic hollow. The University of Glasgow had been founded in 1451, 100 years or so before, as the fourth oldest UK and British Isles university after Oxford, Cambridge and St Andrews. And he left here to go to Paris to learn to be a surgeon. And the reason he went to Paris is he followed the advice of Hippocrates that if you want to learn surgery, you should go to war. And there was a lot of war in France and Spain at that time, the so-called wars of religion. And that's where he learned his craft as a surgeon. And he then returned to Glasgow the last few years of the 16th century, and he found the standards of medical care here in Glasgow in the west of Scotland to be very rudimentary and to be of poor quality and not what he was used to in his clinical practice in Paris. And so with colleagues, he set about setting up the Faculty of Physicians and Surgeons of Glasgow, as we were called at that time. From the very beginning, a multidisciplinary college involving physicians and surgeons, and in those early days, apothecaries, what we nowadays call pharmacists. So from the very beginning, our college has had this thread of being a multidisciplinary college, as we would call it these days. At first, the college only dealt with the west of Scotland and Glasgow, and that was the only place we were concerned with the maintenance and setting of standards in healthcare. However, these days we're a 16,000 strong community in over 100 countries in the world, and there are 15 separate countries represented by you diplomats this evening, from North America and the Caribbean through the Middle East, South Asia, the Far East, and from all over these islands which make up the United Kingdom and the Republic of Ireland. So you're all very welcome with our group this evening, and we welcome you to the college. College crest and mottos are up here above the door that you all came through, and the first one at the top is Conjurata Amici, which means together in friendship. And we hope that in your engagement with us this evening and in the future that you will feel part of a community which is one of friendship and one of welcoming into our building and into our community. So a very warm word of welcome to all of you here this evening. Many of you will be sitting waiting for me to stop talking so that you can get up here and get your hands on that diploma. But before we invite all of you, we have one or two VIP guests to address first of all. And so I'm going to ask John Camilleri Brennan, Surgical Vice President of the College, to come here to the lectern, and he will take over talking from me. And I'm going to ask Professor Debbie McNamara, who is the President of the Royal College of Surgeons in Ireland, to come and join me here at the front an honorary fellowship of the college to Professor McNamara. John.
Mr. President, it is my pleasure and privilege to present Professor Deborah McNamara for the honorary fellowship of this college. Professor McNamara is currently President of the Royal College of Surgeons in Ireland. She grew up in Ireland and qualified from Trinity College Dublin with honours in 1993. She pursued her surgical training and research in Ireland and then undertook a clinical fellowship in colorectal surgery in Paris under the tutelage of Professors Park and Thierry. She is the recipient of a number of prizes, awards and distinctions, including the very prestigious Patey Prize from the Surgical Research Society in 1998, in recognition for her seminal work on the impact of anti-angiogenic agents on the healing anastomosis. Professor McNamara was appointed consultant in general and colorectal surgery at the Beaumont Hospital in Dublin in 2003, the first woman in Ireland to hold such a post. In 2017, she was awarded a personal chair as clinical professor in surgery at the Royal College of Surgeons in Ireland, University of Medicine and Health Sciences. She has published widely on colorectal cancer, addressing clinical, scientific, and health services issues. She has collaborated in an extensive program of clinical, basic science and systems research at the college and at the Beaumont Hospital, with a grant income of more than €5.5 million. She introduced a colorectal cancer biobank, standardized patient pathways, and introduced systematic outcome measurements. Professor McNamara is an internationally recognized leader and role model for gender diversity in surgery. She is also an established national leader in the area of healthcare quality improvement in education and training. A key focus of her work as president of her college is to support the younger generation of surgeons who are dealing with considerable challenges in their careers. She is genuinely committed to continuing her college's engagement with policymakers, regulators, service providers, and patients, especially on issues related to access to surgical care and patient safety. Professor McNamara is very well respected and highly regarded by her patients, colleagues, students, and trainees alike. She is very passionate about the delivery of excellence and the maintenance of the highest standards in surgical practice. Mr. President, it is my great pleasure to invite you to confer the honorary fellowship of this college on Professor Deborah McNamara.
Applause. Professor Deborah McNamara, using the powers invested in me by the College Council of the Royal College of Physicians and Surgeons of Glasgow, I am delighted to confer upon you this honorary fellowship and welcome you to our college community. Thank you. And can I now ask our next recipient of an honorary fellowship this evening, Professor Kevin Fenton, President of the Faculty of Public Health, to come and join me here, and Lorna Willocks to come and present his citation. Thank you, Lorna.
President, it is my privilege to present Professor Kevin Fenton for honorary fellowship of this college. Kevin has one of the most distinguished careers in public health and is a very fitting president of the UK Faculty of Public Health. Kevin's career has involved every aspect of public health, but a clear and consistent thread is sexual health. He has consistently championed this previously neglected area, supported those most stigmatised in our society, and made real improvements to their health. He is Chief Advisor on HIV to the Department of Health, working towards HIV elimination. HIV elimination, how wonderful is that? After initial consultant posts in the UK, Kevin got the dream job in the Centres for Disease Control in Atlanta, initially as Chief of the US Syphilis Elimination Effort, and then as Director for the National Centre for HIV, Hepatitis, Sexually Transmitted Infections and TB Prevention. The list of what he achieved there is truly astonishing. And a small soupçon includes the first US National AIDS Strategy, launch of the National HIV Testing Programme, expansion of their global AIDS programme, and partnering with Congress and the White House on major policy changes, such as removal of the HIV travel ban to the US, remember that one? And modification of the ban on the use of federal funds to support syringe exchange programs. On his return to the UK as National Director of Health and Wellbeing at Public Health England, he has spearheaded innovation and prevention programmes such as tobacco harm reduction, suicide prevention, and on sugar, influencing the government's childhood obesity plan. He led the London public health response to the COVID-19 pandemic and was public health lead for the response to the 2017 London Bridge terror attack. But these honours are not just for what people have achieved, significant as they are, but for what they will achieve, and crucially, the leadership and inspiration they provide to others. Kevin is an outstanding role model in public health, LGBT, and is one of the most influential Black British leaders. Kevin always encourages and supports, right from his early days at the University of the West Indies, a legend, an all-round sportsman, never missing a football game while achieving record marks. Yet he always had time for those around him. Kevin is a good friend to this college. His priorities are climate and health, inequalities and obesity, all priorities of our college and our president. He is even a Glaswegian, having been born here and enjoying returning. I commend him to you for the award of honorary fellowship.
Professor Kevin Fenton, using the powers invested in me by the Council of the Royal College of Physicians and Surgeons of Glasgow, I am delighted to confer upon you this honorary fellowship of our college. Thank you, Kevin. Just by the King of Jordan. Thank you very much. Can I now ask Warren McElroy, Honorary Secretary of the College, to come to the podium and present or ask you to take the oath of allegiance to the college.
I would like to ask all fellows and members to stand who can in preparation to take the oath of allegiance to the college. Do you solemnly and sincerely declare that you will be faithful fellows and members of this college, obey all laws, regulations and bylaws made and to be made by the college, and will do nothing which, in the opinion of the college, is prejudicial to the interests of or derogatory to the honour of the college or of your profession? I do. You may now be seated. I'd now like to invite Dr. Eric Livingston, Vice President Medical, to present the diplomas to all new medical fellows and members as follows. Fellowship Qua Physician, FRCP Glasgow, Dr. Swapnil Sudhakar Jathar. Mamun Mia. Dominique Rouse. So, membership of the college MRCPS Glasgow, Ahmad Bazarat. MRCP UK, Mahmoud Mohammed Shamazuddin Eselhawi. Kathleen McGee. Taiba Nazreen, Salman Yousaf, I'd like to thank Eric. I'd now like to ask Mr. John Camilleri Brennan, FRC Glasgow General Surgery, Vice President Surgical, to present the diplomas to all new surgical fellows and members as follows. The Intercollegiate Specialty Fellowship in Trauma and Orthopaedics, FRCS Glasgow Trauma and Orthopaedics, Venkata Ramana Vatkamalu. For the Intercollegiate Specialty Fellowship in Urology, FRCS Glasgow Urology, Srinath Ileperuma. Rachel McLennan. For the Conjoint Specialty Fellowship in Plastic Surgery from the Malaysian Board, FRCS Plastics Glasgow, Nurshila Isrin Beti Abuzaki. For the Fellowship Qua Surgeon, FRCS Glasgow, Palab Chatterjee. For the Fellowship Qua Surgeon, FRCS Glasgow by election, Mohammed Ayub Ali. Mohammed Ismail Hussain. For the Fellowship Qua Surgeon in Ophthalmology, FRCS Ophthalmology Glasgow, Aria ER. Kalita Kesra Daina Dalrymple. Mohammed Kaoud. For the Membership Qua Surgeon in ENT, MRCS ENT Glasgow, Imelda Rose Sebastian. Membership Qua Surgeon, MRCS Glasgow, Reham Hesham Mahmoud Ahmed Ibrahim. Budika Nuwan Kumara Migasandiaya Kanan Kanmagi. Membership Qua Surgeon in Ophthalmology, MRCS Ophthalmology Glasgow, Abhinav Lumba. Ngozi Ikuka Saribe. Membership of the College, MRCPS Glasgow, Jawad Azim Khan. I would like to thank our VP Surgical. I'd now like to ask Craig Mather, Honorary Secretary of the Faculty of Dental Surgery, to present the diplomas to all new dental fellows and members as follows. The Intercollegiate Specialty Membership in Orthodontics. Oh, sorry, that person's not here, apologies. The membership of the Faculty of Dental Surgery, MFDS, RCPS Glasgow, Clarissa Ju Cheng Ngayam. Poor Craig only had one person to present to. Going to move on to the next faculty, which is Podiatric Medicine. I'd like to invite Mr. David Wiley, Dean of the Faculty of Podiatry Medicine, to come and present the diplomas to all of the new Podiatric Medicine Fellows and members as follows. For the Fellowship of the Faculty of Podiatric Medicine, FFPM RCPS Glasgow, Andrew Cohen. David Elliott Gruhl. Alexander James Townsend. That now concludes the admissions for August 2024. I'll now hand back over to the President. Thank you.
Thank you, Marvin. Well, as the Honorary Secretary read out each of your names and you processed up across the stage, we all applauded. And so we should have, because this has been a tough journey to get to where you are this evening. It is not easy to study for postgraduate examinations. It means a long day or a long night at work or both, and coming home, switching on desk lamps, opening up laptops, getting out textbooks and revising and studying and learning. And that is hard to do. And so it's right and proper that we should recognise your achievement by applauding. So well done. But I think all of you people in these front rows with your lovely colourful gowns on know that there are some other people here tonight who deserve a round of applause. And they are, by and large, sitting behind you here. They are your families and friends, those who've supported you, those who've also sacrificed for you to be sitting in these chairs this evening in your gowns. And so in what has become a tradition in the college, I'm going to ask you to join with me, standing up and turning round and giving them a round of applause, because they deserve our recognition too. So what does it mean to be a new fellow or member of a Royal College? What do Royal Colleges do? What are they about? People often ask me that when I explain what my role is. They say, what do you do? What's all that about? And I suppose at the very rudimentary level, what we're doing this evening is recognising your knowledge, your learning, your professional capacity by awarding these diplomas. And you will now be able to add a post-nominal to your name, whether that might be MRCP or FRCS or MFDS or FFPM. And that's the professional recognition of the work that you have done to be here with us this evening. But the college is a bit more than that, and I would suggest to you that the college is here for you not just this evening, but for the rest of your careers in healthcare. Long after these diplomas are in a frame and you walk past them without even remembering much about the day or the study that was involved, when your photographs have faded from this evening's celebrations, you will still be fellows and members of the Royal College of Physicians and Surgeons of Glasgow. And we would like to connect with you, because that's an important part of this conjuratum each year, being together in friendship. Because healthcare provision can sometimes be quite a lonely space. And we are a community of healthcare professionals, multidisciplinary from 425 years ago, but now with physicians and surgeons and dentists, travel medicine and podiatric medicine as part of our multidisciplinary college. And we're very proud of that multidisciplinary aspect. I mentioned that as a thread running through what we do, because the provision of healthcare is not just about physicians or surgeons, no matter how important surgeons like to think they are, and I am a surgeon. We still need anaesthetists, we need nurses, we need other people for us to be able to deliver good care. And so we encourage you to think of this college as a multidisciplinary home and encourage you to work well in your teams as you go about your professions. The college is also here for you to be involved in, and there are a number of ways that you might consider doing that. One of them, I'm hesitant to mention it this evening, is you might one day want to become an examiner. I know it seems a strange thought that you might go into the room and be on the other side of the table from what you've just experienced, but that is a role. You might want to leave it a year or two yet, but you might want to think about that. The knowledge that you've been examined on is really hard and is growing all the time. In 1950, when my parents went to secondary school, it took 50 years for medical knowledge to double. In 1980, when I was a first-year medical student, it took 7 years for medical knowledge to double. And in 2020, when I was elected to this role, it took 73 days. So there's a lot out there to learn. And part of our role as the college is to help you with that process, because this is not just about learning everything about surgery or dentistry, you know that only too well. It's about knowledge management, about what things do we need to know, what do we need to have at the fingertips, what knowledge do we need to practice medicine safely. And you can have a role here in the college as an educator, and that can begin from your trainee years, helping us with you passing on your knowledge and skills and experience, some of it through skills courses, exam preparation courses. All of that is something which you can be involved in even from your trainee years, and you may want to add to your career as the years go by. We have a very active trainee committee in each of our faculties. That's something, again, which you can consider being involved in. For those doctors who are taking up SAS, or locally employed doctors, we have an active SAS and locally employed doctor group. We have a network for new consultants. A mentoring programme, which we were just discussing this evening at College Council, is growing like topsy as people search for some support in their careers, and that's something which the college can offer to you. We also have a role in policy, and our Honorary Secretary, Morven McElroy, coordinates all of our consultations. And sometimes this is something we really need to hear from you as new fellows and members of the college. What do you think about some of these difficult issues in which we as a college are asked to respond about the provision of healthcare in the UK and elsewhere? So think about being involved in that way. Global health. Many of you come from other countries this evening to be with us, but it's a strong stream of work in our college over the last 10 years to help form global health partnerships. This year, the first dentists in the history of Malawi will graduate from a dental school in Malawi, which our college has helped to set up. We have, through College Council member Steve Mannion, Director of Global Health, begun to form partnerships in northern Malawi, which you could volunteer on, and similarly in Zambia. That global health outreach is something we're very proud of in the college, and is maybe something that might fit for you. It may be that that's not a fit for you, but we also welcome trainees coming from other countries here in the UK, many of them coming through the MTI programme. And only this afternoon, we met with colleagues from Bangladesh to discuss trainees coming from that country and having some experience of the UK before they returned home. So perhaps in your own teams and your own units, you can encourage welcoming and hosting a person coming from another country to be here and experience healthcare in our country. It might also be that you wanted to be involved in some of our other work and policy work, and particularly strongly in our college is the issue of inclusivity and equality, diversity and inclusion. All Royal Colleges and faculties in the UK are conscious of a subject called differential attainment, which is that it is far easier for a white man to navigate postgraduate medical education and assessment than it is for a black woman. Why is that? What are we doing wrong? Why is there not equality of opportunity and attainment in our systems? So that's something that which we are working with our sister colleges and faculties and with the General Medical Council to try and address and to make our college an inclusive one. We pride ourselves on welcoming everybody, no matter their sex or sexuality, their religious belief, any aspect, the colour of their skin. This is an inclusive space in our college, and I hope you will feel welcome to that this evening. But Professor Mo Oo, Dean of the undergraduate faculty at Leeds, leads on all of that work for us on equality and diversity and inclusion. And that's something, again, which you may want to share your experience of and to help us formulate better policy. Those of you who are working overseas can be part of our very wide network now of college committees and chapters in other parts of the world. We're just formulating our policies around that. We have roles for international advisors and those who want to be involved with college life, and we really welcome that. And one of the great privileges of my role has been able to visit fellows and members in other parts of the world and recognise how important this connection back to the college is for them. It's very humbling at times. Certainly we've got a bigger reception in Karachi than I would get in Glasgow most nights of the week with people coming out to see you. So there is a value in being involved with our college, wherever you might practice in the world. We don't do this work alone though, and it's really great this evening to welcome two presidents from our sister colleges. There are 24 faculties and colleges in the UK and Ireland, and it's been a particular privilege this evening to welcome Professor Debbie McNamara from the Royal College of Surgeons in Ireland, with whom we work really closely in surgical assessment, the MRCS and FRCS exams, which many of you have passed here and recognising that this evening. We're about to do similar work across the surgical colleges in dentistry, and a particular connection we have with the Royal College of Surgeons in Ireland is their exemplary leadership in the issue of global surgery. The institution in the world which has done most to make us aware of the issues of the deficit in surgical care in low-income countries is the Royal College of Surgeons in Ireland. So it's a real pleasure to welcome you, Debbie, here this evening, and your daughter Neve sitting over there, to be here and receive an honorary fellowship. And for me, a personal delight to welcome Professor Kevin Fenton. I think we came into office about the same kind of time, Kevin, and I had jotted down a few things that I thought were quite important to talk about, and I thought were very novel. Climate change and health inequalities and obesity, so I've got the same on my list. So he is, after all, the Faculty of Public Health President. I'm a surgeon, but he has been a tremendous support to me as we've tried to formulate policy in these areas, and so thank you for that, Kevin. And I really welcome you being here this evening. He sometimes says to me I'm a frustrated public health doctor, which I think might be, as I come to the end of my career, might have been true, Kevin. So we should have maybe made better choices earlier. And whether or not you choose to be involved in any of these initiatives that I've discussed, be involved with the college. We want to listen to you and hear from you what matters are important to you in your career. And these issues that I've just mentioned have actually come from you, the fellows and members of our college. So in 2022, we took as a theme the climate emergency and environmental sustainability. And we were just hearing in College Council earlier today about how that work has developed over these last 2 years and more to give you some indicators of what are the issues for climate emergency, not just in extreme weather events, but what's the impact of air pollution? What's the impact of delivering healthcare on the environment? 4% in the UK of our carbon output comes from the health service. 2/3 of that from the operating theatres. So those of you who are surgeons in particular, what are you doing about your impact on global warming? Because you're responsible for part of it, and there are things you can do, and we've been helping you with that knowledge and information in a series of webinars. And in 2023, we took as our theme healthcare inequality. Glasgow is one of the poorest parts of the UK. Of the 650 parliamentary constituencies which were just contested on the 4th of July in the UK general election, the 10 poorest in the country are here in this city. And the difference that poverty makes to life expectancy has been well recognised since I was a medical student. So a woman will live for 10 years less in the poorest parts of the community as opposed to the richest parts. The gap for men is larger, and if we look at healthy life years, that gap grows to 19 years. And it's not just about the impact of healthcare, what we can do. Can we get that knowledge out to all of us? Can we share that knowledge? What can we do as healthcare professionals? Some of it is about how we deliver care, making sure it's accessible to everybody. Not just accessible as in we've got the NHS here in the UK and we're very lucky and everybody can come, because the delivery of healthcare is maybe only 20% of the impact on human health. Much of that is about the environment people work in, and what can we do to share that information and share that knowledge. And through the academy and the leadership Kevin Fenton has shown, we are now working with government bodies, policymakers and others to share that information. And this year, at our President's Conference, the 14th of November, we're going to talk about obesity, which is a really difficult topic to talk about. I came into office nearly 3 years ago, and my predecessors all assured me that I would put on weight in office. I said, no, not me, I'll be going to the gym, and it's happened. We all gradually, incrementally get a bit bigger as we get older, and in this job I certainly have. What can we do about that? Because 2/3 of the adult population of the UK are overweight or obese. And when we look at children, on the first day they come to primary school, 22% of them are overweight or obese at the age of 5. And that's not equally distributed through society either. Because for the first time probably in human history, the most overweight are the poorest in our society. Not the people with the means to buy more food, but the people who don't have access to the food which might help their health. So in this year's conference, we're going to talk about the background to all of that. We're also going to talk about how we as healthcare professionals can deal with that. We're going to hear about the impact in different specialties, in obstetrics and anaesthesia. What does it mean to be dealing with people who are very overweight? How do we deliver safe care? And we'll hear, very importantly, from the lived experience of people who are struggling with that in their lives. And we'll consider how we might prevent that going forward. So I hope the college has something to offer all of you. But perhaps the most important thing we have to offer is that sense of community and connection, which we hope will help you with your well-being as you go forward in your careers. And that's been a very key theme in the college since the time of my predecessor, Professor Jackie Taylor. And we have, and some of you will have seen downstairs, this little journal of well-being to try and help you look after yourselves. Because being a healthcare professional, whatever your specialty, is not an easy task, and it does take its toll. And interestingly, the founders of the college must have known something about that, because the second motto down at the bottom of that crest there is non vivere sed valeri vita, which means not just to live, but to live well. That's what's important. And if we look across the health service, 40% or so of our total staff group are suffering from what we now call common mental health disorder, anxiety, depression. They're worried about going to work, they're worried about their lives. A significant proportion are abusing drugs and alcohol, maybe a quarter. Some people really do have the symptoms of post-traumatic stress disorder. What do we do about that as a group, as a community in this college? Well, the important thing is we flag that up to you at all of these ceremonies. Today is an exciting and wonderful day, and we celebrate with you your achievement, and we welcome you into the college. But remember the word of warning that you need to look after yourselves as the years go by. And running through this booklet of little tips and tricks, you'll find 5 themes, and you can identify these around there. And the first of these in well-being is to take notice and to be conscious of the present moment in your lives. Really happy present moment this evening, I hope, for all of you. There's a tendency in human beings to dwell on the past or to make plans for the future. Try and take joy and happiness from this moment, from today, from the present time. Be active. Keep fit, be active. Go for a walk, run, go to the gym, get on your bike. Be active, because physical activity is really good for your mental health. Connect. Connect with other people, with your friends and family who are here with you this evening. You'll obviously, and I hope, continue to do that. Connect with your colleagues, connect with your neighbours, connect with your faith communities, whoever it might be. Do not be alone. The US Surgeon General has estimated that loneliness, the subjective feeling of being alone, has the same impact on your health as smoking 10 cigarettes a day. So do not allow yourselves to be alone. Try and connect with other people, because that will sustain you in your careers. And the fourth important point is to learn. Now that seems a terrible thing to say in a day when you're just celebrating all this learning you've been doing. But it is really important to keep on learning. And not just to learn about medical and surgical and dental things, but learn about other things. Don't just read the medical journals, read some novels, some plays, some poetry. Develop some hobbies and interests which will sustain you in what I hope are long and happy and healthy careers. And the fifth thing to say about well-being is a really difficult one, which is I'm going to ask you to give. Now that's a very counterintuitive thing to say. I've just been telling you how burnt out you're all going to be and how anxious you're going to be, and I'm going to say now I'd like you to give something. But there is no shortage of evidence that in giving, you yourself will gain. Now we've given you two outstanding examples this evening of people who have really given in their careers, Professor Debbie McNamara and Professor Kevin Fenton. Very few of us will have the capacity to follow their example, but I hope some of you do. But each one of you, every day you go to work as a healthcare professional, whatever your specialty, has the opportunity to give, particularly in that interaction with a patient. Just you and that patient, one-to-one. Please give of your very best, because you will be rewarded for that gift that you give of yourself and your knowledge and your learning and your professional capacity. So with those words, I warmly welcome you into our college community. We celebrate with you, and we're going to process out of here and celebrate some more downstairs with your friends and family. You are very welcome to our college community. We wish you long, happy, healthy, fulfilled careers, and I look forward to meeting many of you and your families downstairs in a moment. Please stand. I get to you first.